listening to that presentation, hearing about a piece of technology that can heal wounds faster, it's the sort of thing we might need in Westminster. I've just come from Westminster, where levels of trust are low, and so it's nice to be here at the Royal Society of Medicine, because trust me, I'm a doctor is a more reassuring phrase. In fact, it's so reassuring a phrase that it's a punchline. And not only we politicians, we citizens, we trust doctors and nurses more than any other profession. This bond of trust is both implicit and it's unspoken of very often. And I just wanted to talk about that today and talk about some of the things that we need to do to ensure that that bond of trust remains strong. The thing is that our doctors, our clinicians see us at our most vulnerable, see us at our weakest, and hold our lives and the lives of those we love in your care. I was reminded of this unspoken bond of trust last week. I was at the Princess Alexandra Hospital in Harlow, and I met a mother with her newborn in their maternity unit. And everything had gone well with the delivery, and she was looking forward to taking her healthy baby home. They were confident enough that the baby was in good shape and that the mother was happy that they allowed the Secretary of State to meet them. And the joy was visible, and the relief in her face is something that I recognized. I felt it myself with my 3 children. And she had put all of her trust in the midwives and the nurses and the doctors at that hospital. And she spoke about it. And the thing is that when we trust the NHS in particular, we trust it with something that is precious to us. The NHS has saved the lives of people who I love, and so I trust it. And we trust you because we know that the NHS will do everything it can to help us, that it won't give up on us, and that the safety and the life of my child is as important to you as it is to me. But we can't take that trust for granted, and that's the theme I wanted to develop today. It has to be earned and it has to be protected. And I think also, if we're honest with ourselves, this is why when that trust is forsaken, the shock is very profound. When I learned about what happened, for instance, at Gosport Hospital, I was shocked. Families had entrusted their loved ones into the care of doctors and nurses, and elderly relatives at their most vulnerable and frail were failed by a system that took them for granted. Think about your grandmother, your father. How would it feel if the people you trusted most had let you down? I get it. I understand this. And as Health Secretary, I'm sorry to those families in Gosport and LCH and mid-staffs and everyone else who's been let down. And so for all my love of the NHS and for my love and enthusiasm for new technology and my support, deep respect for everybody who works in the NHS, we need to make sure that we address this question and do everything we can to ensure that that bond of trust is strong. Now, today, I'm not here to point fingers and blame people. In fact, I think that's counterproductive. Instead, we need to learn the right lessons about creating a caring and compassionate culture and about protecting and renewing, constantly improving that bond of trust between the public and the NHS, with its place as our nation's most loved and respected institution. The other thing I was reminded of last week is that leaders create that culture. And it's true with respect to the presentation that we've just had. The culture of continuous improvement and of constantly striving to improve each area of care is a vital part of the culture that we need to instill and expand across the NHS. The example from Harlow is this. After I spoke to that new mother, I spoke to the chief executive, Lance McCarthy, and I asked him, what do they do when things go wrong? I'd seen an example when things had gone right. What do they do when things go wrong? And what's his approach to mistakes? And he gave me a brilliant answer that I thought was worth repeating. He said, if we've made a mistake, then we've made a mistake. We should be open and honest and apologize, and not be afraid to apologize because of any potential legal action. I want to come on to this point in a minute. And as Secretary of State, that is exactly what I want to hear. Because the truth is this: in life, we all make mistakes, and healthcare is a risky business. We should strive to avoid them, of course we should, but the fact of a mistake isn't the biggest problem. It's how we respond to them and how we learn from them. That's what's most important. And we must never let our fear of the consequences stop us doing the right thing. So what Lance has done at his trust is introduce a behaviour charter where patients, their families and medical colleagues know what they can expect. Openness, honesty, trustworthiness. That way, when mistakes do happen, there's an honest conversation. This is what went wrong. We're sorry. This is what we'll do to fix it. It's not an admission of liability per se. It's an acknowledgement that we can all do better and we can learn. It's often the first step towards acceptance for the patient or their family. And it's a vital part of the process of continuous improvement we need to see everywhere in the NHS. Taking responsibility, learning the lessons that can be learned, continuous improvement. And what Lance has found is that clinical negligence claims haven't gone up at his trust since they introduced the new charter. In fact, Lance believes when people feel like they've been treated with honesty and candour, they're less likely to resort to legal action. The simple act of saying sorry maintains the bond of trust with the public, even when things don't go as planned. This isn't just a moral issue for the NHS, as important as that is, it's a financial issue as well. Compensation payouts have quadrupled from £500 million to £2 billion a year over the past decade. This is unacceptable and it's clearly unsustainable. If we don't do something about the growing number and value of clinical negligence claims, it threatens to swallow up the record £20.5 billion a year we're putting into the NHS and derail the long-term plan to transform the health service. And that infuriates me, because it's an injustice for taxpayers as well as for our hard-working NHS staff. We have a once-in-a-generation opportunity to put our health service on a forward footing so we can look to the future with confidence. We can't afford to let that go to waste. So there is both a moral and a financial urgency to act and improve patient safety. So there's less paperwork for medical staff, more time for patients, faster resolution for those who are wronged, and therefore more money for frontline services and less taxpayers' money going to lawyers. With apologies to lawyers in the room, I don't have anything personal against lawyers. I want to see money spent on the front line instead. So that's the approach that we're taking as we put together our new patient safety strategy. Creating a more just culture in the NHS and a more open and honest and trustworthy culture, and it starts from the top. Getting the right leadership is vital. We need more people with clinical backgrounds and more people from outside the NHS. We need to ensure they get the right support, the right training and development, so our leaders can lead their organisations effectively and create the right culture for staff and patients. How do we strengthen this leadership? How do we encourage more inspirational leaders? How do we ensure that we can hold to account that leadership once it is in place? First, and perhaps counterintuitively, I think we need to cut the turnover rate at the top. From all I've seen, I think that to improve leadership in the NHS, we need to fire fewer people and attract the best talent. NHS leaders have some of the toughest yet most rewarding jobs in the country, so let's support them to do the job they need to do. And I think that will encourage more to step in and step up. Next, we need to have a better structure, both to support and hold to account. Today, we're publishing Tom Cark's review into how we can improve NHS leadership. I want to thank Tom for the work that he's done, and I welcome his recommendations. Cark recommends that all directors must meet minimum competency standards to sit on the board of any health organisation. And where training is needed to meet those new standards, then it should be available. He also recommends a central directors database where information about qualifications and employment history can be easily assessed. These new recommendations will ensure the fit and proper persons test is met, and unqualified or unsuitable staff can't just move somewhere else in the NHS. We accept these recommendations in full and will get on with implementing them immediately. I've asked Dido Harding to consider the further recommendations and how we can implement these throughout the health service. Third, we're working with the Healthcare Safety Investigation Branch and NHS Improvement to give more support to families when things go wrong. A new family engagement model will ensure relatives play an integral part in any investigation, that their concerns, their complaints are listened to and acted on. Nobody should feel like they're being fobbed off or a nuisance. We must give families all the information in an open and transparent way and ensure they're treated with sensitivity and compassion before, during, and after an investigation. That's the same approach we'll be taking when independent medical examiners start being introduced across England from April. Every death will be scrutinised by either a coroner or a medical examiner, and medical examiners will be someone bereaved families can talk to about their concerns. They'll ensure investigations take place where necessary, help detect and deter criminal activity, and promote good practice. This new system is going to be overseen by the new independent national medical examiner, and training will take place to ensure consistency of approach and a record of scrutiny. Finally, we need to encourage whistleblowing. Despite our best efforts, mistakes happen. We're all human, we're all fallible. Any doctor who says they've never made an error isn't telling the truth, and the truth is more important than any one error. Mistakes need to be seen as an opportunity to learn and improve, not a need for cover-up and denial. Honest feedback is a gift, and believe me, I know this because I get a lot of it. I believe that whistleblowers are doing the NHS a great service. Someone who has the courage to speak up and put their head above the parapet should be encouraged and embraced. Yet sadly, as we all know, all too often they're ignored or bullied and worse, forced out. Making someone choose between the job they love and speaking the truth to keep patients safe is morally abhorrent and operationally foolish. It's an injustice and I'm determined to end it. We've got to change the way the system views whistleblowers from a problem to a part of the solution. And of course, this means embedding a learn not blame culture in every part of the NHS and to ensure there's protections for staff and the public who speak up to save lives. So we've got to get the right leaders to create the right culture, a just culture, an honest, open, trustworthy culture of learn not blame, saying sorry when we get it wrong, earning the public's trust and never taking it for granted, encouraging and supporting people with the bravery to speak up. There's no one solution to patient safety. It's a series of steps. It's a path of continuous learning and improvement. There's always more we can do. We can always keep striving to do better. I want Britain to be the best country in the world to be born. That begins with making the NHS the best and the safest place in the world to give birth. I want every parent to experience the same joy that mother of that newborn did last week. Thanks to our brilliant NHS staff, we can make this happen. Let us renew that bond of trust with the public. Make it a public spoken bond of trust. We will always be open with you and honest with you when things go right and when things go wrong. And that way, you can always trust the NHS to be there for you and for your family. Thank you very much.